to malignant pleural mesothelioma and argue that surgery is simply useless, that we shouldn't even be discussing surgery for this disease. And so I looked at all series by some notable people and looked at the 5-year survival reported in those series. And we see the range is 9 to 27%. In surgery-based treatment, this includes 2 types of surgical techniques that I will describe. To put that in the context of diseases with which most of the people in this audience are more familiar, it kind of resembles pancreatic cancer. And there are many similarities from a tumor biology perspective and a multimodality therapy perspective. But the point is, pleural mesothelioma is on the map. Now there are survivors. And I believe much of that may be attributable to surgery-based therapy, but this is a controversial subject. So how do we improve survival in this very challenging disease? First is to refine the treatment. If you knock everyone off, like in that series that Bouchard published in '76, people aren't going to survive the disease. But the second part of that is to refine patient selection, and I'll discuss both of these. So the goal of surgery in malignant pleural mesothelioma is to optimize cytoreduction. We talk about, this is a term coined by Dave Sugarbaker, macroscopic complete resection. This is different than the R0 resection most people in this room are used to describing and attaining. We don't get microscopically negative margins when we resect this disease. I mean, this is a disease of the pleural lining. It's essentially carcinomatosis by definition. But this gross resection disease, no visible disease, can be obtained with 2 different techniques. One is pleurectomy decortication. That's removal of the lining of the lung, the parietal and visceral pleura, sometimes the pericardium, sometimes the diaphragm, depending on extensive disease. And then there's the extrapleural pneumonectomy. That's the same, but includes removal of the entire lung. And generally with EPP, or extrapleural pneumonectomy, the pericardium and diaphragm are taken as well. Now, over the years, many surgeons and others have worked towards refining that technique and reducing the perioperative mortality